Hi, my name is Gwendolyn Pearsall-Reed. I'm a social worker with the dialysis community, and I actually work for Fresenius Medical Care. I've been with them since 2006, off and on. I think I left for about a year, maybe a year and a half, but we're back together, and I've been in this community for quite a while. I wanted to talk to you a little bit about what can your social worker do for you. Many are miffed as to what that social worker does, walking around the clinic and just looking like they just talk to people. Well, the beautiful thing is they are talking to people and talking to everybody, and they're doing a whole lot of things that you may be unfamiliar with. To know that they can be of a helping source for you. So let's talk the generics, the stuff that you see them do and know concretely that they can do. So you come on, you're a new patient, old patient, you're new to the dialysis community. Suppose you come on with no insurance. So insurance issues, insurance problems, not having insurance for your medicine, those things your social worker can assist with and help guide you through insurance issues. In Fresenius's case, we also have an insurance coordinator that does the bulk of the insurance issues, but being the face that you see every day that you come to dialysis, your social worker is, your primary go-to in connection with getting those insurance issues resolved. So that's concrete. Next thing you'll think of is, okay, what if I can't get to dialysis? Well, your social worker also can provide you with resources in your community, connect you if you are Medicaid eligible for transportation benefits, connect you with those standing orders for transportation to make sure you get back and forth. Those two things, most people think that's all a social worker does. However, our job is actually to help you deal with a bunch of stuff. A bunch of stuff meaning life that now has started to feel like it's interfering with being interfered by dialysis. We are there to help guide you or get you through those humps. So we have many hats that we wear. We can advocate for you in different situations. We can help to mediate any kind of conflict you might have while something's not going right during your dialysis treatment. You can't speak to the technician or the nurse that's caring for you, and you want a new solution or you want to talk to somebody about it. Well, your social worker can be a mediator in that situation. If there is a grievance or concern, we could take it further and also assist in getting that resolved. We are part of that mediation and chain of command to make things work a little bit better for you. Or try to see where the issue lies and where education could be a possible solution or more compassion for whatever your particular situation is. So that could be something we do. Suppose that you are having a hard time with some family issues that are keeping you from getting to your treatment too. Sometimes it's childcare issues, spousal situations, or grief that you're going through because you just lost a loved one that was real close to you. We can do a bunch of stuff to help assist you getting through those stages or that hump for you. And that's some mini counseling that we can initiate with you, get a full assessment to see, hey, how are you doing and how are you able to deal with change as change happens, life situations that could bring you down temporarily. How are you dealing with depression? Are we talking depression long term? Are we talking short term bouts of depression because of a situation that's come along? We can help to decipher that, and depending on the individual's particular licensure, we can either initiate some counseling with you or help connect you with a psychotherapist that can further assist you with long-term therapy to get you get you through grief, PTSD, all kinds of mental health disorders that would take definitely more intense therapy than your dialysis social worker would be able to provide you in such a not so private situation. We try our best to have our one-on-one short-term counselings that can get us a feel for what your absolute needs are, but at the same time, we want to be able to help you get to what's going to best serve you. And in doing so, that means we could refer out to a mental health provider if you're having some difficulty past, just a just a hump in the road. If it's more than just a hump and it is debilitating what your day-to-day functioning, then it may be time to consider that psychotherapy, and we can help guide you in that direction and refer you with the help of your nephrologist. There are plenty of other situations that could your social worker could be of resource to you. Say your family doesn't understand what you're going through. We can also help to educate your family. We can have or create a family conference where, if your partner, wife, husband, significant other is just not on board with you having to dedicate so much time in dialysis, or don't understand what you're actually going through physically or medically, or then your social worker can help with that family dynamics and have a meeting and help educate your family member. There are other treatment options out there. So your social worker can also educate you in different ways to show you what the other options are, as well as show you or get you prepared for the next option. Say you're on in-center dialysis, but you want to work full time, you want to do A, B, C, and D, you want to get back to, being outside of the confinements of a clinic. Well, we can educate you on treatment options. Now, in Fresenius, we actually have a kidney care advocate that does more direct one-on-one education with treatment options, going home on home therapy. But if that is not the case in your dialysis program, then your social worker can educate you on the other treatment options. We can also refer out to transplant. Say you're excited about possibly getting a transplant. Well, we can guide you through that as well and refer you out. That is with the expressed okay from your physician. You might, it's a discussion to have with the social worker to say, hey, do you think I should? And our first conversation is going to be, what does transplant really entail? And then the second is going to be, mostly you might want to speak to your physician about, hey, I'm interested, and do you know of any hurdles that could prevent me from being a candidate? So that is just a small portion of what your social worker does. But if it's not something to do with your prescription as far as going to being on dialysis, if it's not to do with your diet, it's probably going to the social worker to try and help assist you through whatever it is that you're going through. We can be there to help you through a lot. So talk to your social worker and make her or him, your new bestie in the clinic when you have those problems that make it hard for you. Thank you. It's good talking to you. Bye-bye.